Hi, I'm Colleen Wachter and I'm the Executive Director of the ALS Association Mid-America Chapter. I hope that you're staying safe and that you're staying well. While these certainly are times like no other, I did want to take a couple of minutes to give you an update from the Mid-America Chapter. Over the last couple of years, the number of families that we serve continues to increase drastically each year, and we don't see that slowing down anytime soon. We've been able to grow our clinical networks by adding 2 new clinics, one in Columbia, Missouri, and one in Wichita, Kansas. In addition, we've added the Quality of Life Grants program, which is shown to be necessary and vital to the families that we serve. In the last 2 years, we've seen our walks reach record levels, thanks to many of you for stepping up to serve as a team captain, to walk, and to donate. National and local advocacy continues to be a priority while we focus on impacting policy that affects families living with ALS, as well as advocating for continued funding of the ALS research project through the Department of Defense. On March 16th, we sent our staff home to begin working remotely. We suspended all in-person meetings and began working closely with our clinical partners to continue to provide access to critical healthcare through our clinics. As you can imagine, setting up remote offices for 20 employees in 3 states was not an easy task. However, we had begun disaster preparedness planning several years earlier, so we were able to get it done quickly. We've drastically increased communication and communication methods. Phone calls, emails, and now teleconferencing have become vital in order to keep staff connected to each other, with their departments, their offices, the families we serve, walkers, volunteers, and donors. We have 2 support groups that meet monthly virtually. Our durable medical equipment is still being delivered with as little of contact as possible. All of our clinics have moved to remote and virtual clinics. During this time, we've seen an increase in requests for services and programs in all of our service area. We anticipate that this will be the new normal for the foreseeable future. While we've experienced an increase in requests for services, we've also experienced a downturn in giving. We know this is tough economical times and that many folks have responded to the crisis in their own communities. We believe we can weather this storm in the short term due to 40+ years of efficiency and planning. So ALS hasn't stopped for this pandemic, and neither will we. We hope you won't stop either. In closing, while we certainly recognize that these are times like no other, there are many things that I am grateful for. I am grateful for an incredible staff who took on the challenge with no complaints and worked tirelessly to continue to innovate, adapt, and move our mission forward. I'm grateful for our board of directors who are stepping up to lead in ways we never thought they would have to. I'm grateful for our donors who continue to stay with us and support our mission in the most difficult times. And I'm grateful for the entire ALS community who are checking in on us and asking what they can do to help. Thank you.